Uvlalotuk, Uvingla Atika Melanie Duckworth. This Inupiaq phrase translates in English to good morning or good day. My name is Melanie Duckworth. I am happy to be invited as a presenter for this conference and wanted to recognize the importance of Indigenous culture in this discussion. I am a Master of Public Health student at the University of Alaska Anchorage, and I'm ready to share with you all some information on the topic of key strategies to improve health in Arctic populations. The objectives for this speech are to identify who our target population is in the current significant health issues in the circumpolar regions. And then we'll describe the three main strategies that would best address these issues in ways that can be implemented most effectively. These strategies would be to mitigate the impact of climate change, increase resiliency of Indigenous populations, and support Native culture and traditions. And they come from evidence-based practices and research. To begin with, it is important to understand our audience before attempting to focus on specific health issues of that population. Circumpolar regions encompass both the North and South poles, but for the purpose of circumpolar health, there are only Indigenous populations in the Arctic. The Indigenous peoples of the circumpolar North live in an environment that's unique to that region, with culture and traditions that tie them to the land. This is an important consideration when discussing health issues for circumpolar populations. So in Indigenous populations of the circumpolar North, there have been a few key issues in public health that we can address. And the first one is lost cultural identity that leads to a loss of self-value. And so studies of populations in the North have shown increased mental disorders and self-destructive behavior due to the loss of cultural identity. And another one is climate change. So the climate change has an immediate impact that causes insecurity and instability, not only because of unsafe housing conditions due to actual shifting of the earth, but also lack of available foods due to changes in the ability to gather traditional foods. And then the third thing is the low-income households. There is a higher prevalence of low socioeconomic status households in circumpolar regions, and this has been related to increased risk of chronic illnesses. So with those low SES households, we're seeing higher rates of obesity, diabetes, and heart disease. So the first strategy addresses climate change because evidence-based research shows a correlation between increased surface temperatures and a drastically changing Arctic landscape. While the change seems small to most of the world, it's impacting the Arctic environment significantly. I think an obvious way to describe it is if we think of the Arctic as the world's canary in a coal mine, so to speak. So as everyone else sees the effect of climate change, then they realize the dangers that are associated with not caring for the environment, but by the time that happens, the damage is irreversible. So while it may be too late for many Arctic populations, others will begin to make a positive change. Well, rather than waiting for the Arctic populations to prove the theory of climate change dramatically impacting health, perhaps we could mitigate that now. So currently, permafrost melting has caused previously permanent structures in villages to collapse. The loss of entire villages has already been documented, and many other villages are in danger of being eradicated by climate change. The immediate impact of this loss is losing homes, losing the ability to obtain safe drinking water and sanitation, because these all rely on structural stability. The long-term consequences of climate change include those stressors due to instability of housing and food availability, and they also alter migration patterns, which impacts subsistence food harvesting. So for those not living where permafrost is melting, they may experience this impact anyway. Although climate change is already happening, we can mitigate the damage by bolstering the supply chain to provide more stability to affected Arctic families. Some current policies have been implemented to provide supplies for village relocation and structural redesign. For certain Alaskan communities, this strategy has at least provided some support. Another way that we can supplement supply chains to mitigate this damage to provide more nutritious food supplies, and this will supplement the insecurity from impacted subsistence harvesting. Despite the detriment of climate change on subsistence activities, these traditional activities should be encouraged, as a loss of cultural identity has contributed to the decline in mental health of Indigenous circumpolar populations. Specifically, support of One Health and the International Congress of Circumpolar Health are key components of implementing this strategy to support native cultures and traditions. By involving local communities with researchers and industry leaders, local voices will be able to explain the best ways of improving health services. For some remote locations, this could be in the form of improving communication services. So for this intervention, public health experts could discuss ways to build better telecom or internet connections that would support health services in rural areas. The purpose of One Health is to recognize that individual communities have unique needs and require more than a one-size-fits-all approach. So the One Health initiative has been proven to provide the resilience needed by Arctic populations to overcome past acculturation and move forward while embracing their cultural identity. This program brings together people of various disciplines to build a framework of resiliency in communities using traditional teaching and learning techniques such as talking circles. And this correlates with the third strategy of improving the health of Arctic populations by increasing resiliency. So by supporting cultural identity and providing the tools necessary to ensure stability, circumpolar populations can focus on building that much needed resiliency. As the Arctic landscape changes, the populations living in the Arctic must learn to adapt and change with it, but do so while keeping their cultural heritage. As the One Health initiative already determined, resiliency is needed as Arctic populations face continued adversity and change. To do this, public health leaders should connect with counselors and local community leaders to determine the most effective methods for engaging the community. It is important to reestablish traditions that connect local people to their heritage and the land. Resilience building may come from talking circles or dance groups. These two activities have been proven effective for some Alaska Native communities. But for building resiliency, the local communities really need support to be physical, psychological, and organizational. So supporting them physically, supporting their mental health needs, and also providing organizational or structural support. So with all of this in mind, I would recommend that all countries with Indigenous Arctic populations within their borders work together in support of the One Health initiative and the ICCH. In doing so, we can address each of the three key strategies to improve health of Arctic populations. First, we need to take more steps in mitigating the impact of climate change. For Arctic communities, this should be immediate support to rebuild damaged infrastructure or relocate villages, as well as providing monetary support for supplies such as healthy foods to offset the impact of food insecurity due to climate change. Second, we must support cultural identity and make sure all Indigenous leaders have a voice in the discussions. Support for Native traditions and languages must be a priority for all countries with Arctic populations. The final challenge is to engage local communities in order to strengthen them and support Native traditions. Give them the specific tools needed to build resiliency within their own communities. Lastly, I want to show everyone my references, and I encourage you to read these articles and learn for yourself the information that I've found in them. They're very helpful and provide a good framework for addressing health needs in Arctic populations. Thank you for listening to me, and have a great day.